Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
What in the world is SAMe is a question that comes up often when people talk about taking different supplements. And you have maybe heard of SAMe. Maybe you have a friend or a family member, a coworker that told you all about SAMe and that it's very good for your mood. Well, I want to tell you all about SAMe, talk about the history of SAMe, what SAMe is actually doing in the human body, and it certainly goes far beyond that of mood. And if you were just thinking of SAMe just to try to promote a healthier state of mind, certainly that's a great thing. But I also want you to know more about what SAMe can actually do for your overall health. I am Amanda Williams, MD, MPH, and let's get right to it. Let's talk about SAMe. What in the world is this? Well, SAMe was first discovered in 1952 by an Italian scientist and former National Institute of Health biochemistry director. And what it is, it's an endogenous, so it means it's naturally occurring, intracellular amino acid metabolite and enzyme co-substrate involved in multiple crucial biochemical pathways, including the biosynthesis of, yes, neurotransmitters, which is why it can be beneficial for mood, but also for hormones. And we know that we can assess SAMe concentrations in the blood, as well as in the CSF, which is the cerebrospinal fluid. Now, what do we know about SAMe? So this is something that's been in the human body since the beginning of time, but yet it was only discovered back in 1952. Well, first, SAMe is S, so we're talking about structure here. So S-adenosyl L-methionine. So we oftentimes just shorten it up and just call it SAMe, which makes sense because that's kind of a lot to say. The adenosyl L-methionine, quite long. So what do we know about SAMe, and how do we recognize its importance in the human body? Well, clearly we know that there have been numerous human clinical trials now utilizing SAMe in terms of supplementation for clinical depression, for example. And there is extreme evidence out there for the utilization. The Journal of Clinical Psychiatry back in 2009, they actually published their findings and saying, yes, there is evidence that supports the use of SAMe for the treatment of major depressive disorder. And what we know is that there are so many different antidepressant prescription medications that are available, but many people don't respond well to them. So they have, remission rates. So people get put on one antidepressant, maybe they feel better for a few months, and the next thing they're back to their low mood. So they have looked at SAMe, this endogenously occurring substance, and say, okay, well, maybe if we're low in SAMe and we bring that level back up to where it should be, perhaps this can help to stabilize. Because remember, one of the things that SAMe is actually doing is it plays a critical role, a very critical role in biochemical pathways, including the biosynthesis of neurotransmitters. So hence, we go back to the study that was published in the Journal of Clinical Psychiatry, and we can see, okay, well, yeah, then that would certainly support that hypothesis that if we have this endogenous amino acid substrate, basically, in the human body, and it's not at a high enough level, then this can be impacting not only our mood, but many other things. And then when you look at why someone may not be responding well to a typical antidepressant, well, say, for example, you're on an SSRI, a selective serotonin reuptake inhibitor. Well, the point of that is to try and maintain your serotonin levels. But if you don't have enough serotonin to begin with, then it makes it very hard for that drug to actually work properly. So we know that SAMe is playing a role in the synthesis of all of these different neurotransmitters. So if we have more SAMe, then perhaps the body will make enough of those neurotransmitters to help create stability. So they have, basically declared that, yeah, SAMe can be a really wonderful adjuvant therapy or a primary therapy for those who are suffering from different mood disorders, including depression. So we know that we certainly can see how beneficial this can be in alleviating depression, which is why most of the original science in the clinical research was focused on that regard. But then they said, okay, well, if it's dealing with other pathways, it certainly goes beyond that of what we know of just neurotransmitters. We also know it's affecting hormones, and we know that it can affect different methylation pathways. And that's probably one of the most important processes of SAMe is involved in methylation, which it acts as a methyl donor to support a multitude of different chemical reactions. So we have these different very important vital biochemical processes that occur and rely on methylation, including things such as the synthesis of our nucleic acids, so for DNA and RNA. When we look at phospholipids, why are phospholipids important? Well, they help to protect our cellular membranes. We can look at those neurotransmitters. We can also look at gene expression. We can look at mineral metabolism. Certainly we know that that membrane structure and fluidity is important when we look at those phospholipids. And we know that the body has to detoxify, which goes through these methylation pathways. So we fast forward 70 years and we know so much more about SAMe at this point in time. So we've even been able to recognize the role that SAMe plays when it comes to things like Alzheimer's. And certainly when we look at different inflammatory conditions such as osteoarthritis, there are multiple research studies out there looking at SAMe for osteoarthritis patients, and studies in people have compared oral SAMe supplementation with NSAIDs. So when we think about the NSAIDs, your acetaminophen, your ibuprofens, and they have found that people actually had similar pain relief utilizing SAMe compared to the NSAIDs, but didn't have any of those side effects. So this is really, really important. Then we can look at the liver, because we think about that membrane fluidity and people think about fatty liver disease. Okay, well, we know that non-alcoholic fatty liver disease is certainly a problem throughout the world, but in particular here in the United States, and primarily brought on because of diet. And what we know is that SAMe, when we think about that methylation process and that detoxification pathways, SAMe plays a real key role in this as well. So a lot of science out there showing how SAMe's biochemical effects actually can impede the different diseases that we commonly think of in the aging process. And I think for many people out there across the spectrum, maybe it's fibromyalgia, maybe you're dealing with some type of a neurodegenerative disorder or a sleep issue, insomnia, inflammatory bowel disease, for example. Clearly, I just mentioned issues with liver health, as well as looking at osteoarthritis, which we know that millions of Americans deal with osteoarthritis. I mean, it's an astronomically high number of people who suffer with osteoarthritis each and every single year. And their primary thing that they turn to is NSAIDs. And then the long-term use of those NSAIDs can lead to issues with kidney disorder, can lead to issues with liver disorder. So we know all of these different things. So initially, yes, SAMe, mood, helping to maintain stable mood. But now we know that it can promote liver health. It supports healthy joint function. And for a lot of folks out there, when they are thinking about different supplements to take, this is one of those ones that oftentimes gets overlooked. And I like to talk about it because I see all of the many ways that this endogenous substance, this is naturally in our body. If we don't have enough of it, then it makes sense that things would go awry. So I want to talk about a study that was in the PLOS One journal, which is a really large peer-reviewed journal, talking about SAMe for the treatment of chronic liver disease. Now, this was a meta-analysis, meaning that they were looking at multiple different studies that assessed using SAMe for the treatment of people that had different types of liver diseases. And what they found was that SAMe could be used as the basis of medication regimen for liver function improvement because of its safety. So I think that when we talk about different nutrients and we recognize that there are so many different things in the human body that many people are just unaware of. We don't think about glutathione. We don't think about, our catalase levels or things like that. But here's another interesting fact about SAMe. SAMe actually helps to boost our endogenous antioxidant levels. It helps to drive up the amount of glutathione in the body. And we know glutathione plays a critical role in so many aspects of our health and detoxification. SAMe helps to boost the levels of superoxide dismutase, which is highly important for our cardiovascular health. Because if we have low SOD levels, superoxide dismutase levels, then we are probably more prone to having vascular stenosis occurring. So meaning your vessels become too narrow, which makes it harder for the blood to pump through those. That's a problem. Now, here's one point to be noted about SAMe. And this is something that for many people who take SAMe aren't even aware of this, but if they're taking SAMe, they're most likely already taking a multivitamin. But I always encourage people to make sure that they are taking SAMe in conjunction with its cofactors in order for it to function at the way we need it to function. And that is those B vitamins. So B12, B6, and folic acid. So my advice is when you take SAMe is to take that in conjunction with methyl B, those activated B vitamins. And then you're really allowing the body to utilize what it really needs to go through these different phases of biochemical processes each and every single day. So we know that there are many different ways in which we need our B vitamins, from the immune system to the creation of red blood cells, but we also rely on those B vitamins, folate, B12, B6, when it comes to the methylation cycle. And so those work synergistically and they are reliant on each other. So this is why when you take SAMe, it's always advantageous to make sure at minimum you are taking a multivitamin, but I encourage you to take an activated B vitamin, such as the methyl B. Now, a lot of the head-to-head trials, when it comes to the mood issues with SAMe, are really quite impressive. When they compare SAMe to many of the different tricyclic antidepressants as well as the SSRIs, SAMe comes out looking wonderful. And part of that reason is the lessening of side effects that we know that many of the prescribed antidepressants can create, but just the stabilization that the SAMe can bring upon when it comes to creating a overall better mood. And we're talking about people who have been diagnosed with major depressive disorders. So a lot of ways in which SAMe can help to support our wellness. We think about joint health. I mean, oftentimes people would never think of SAMe being correlated with osteoarthritis or with fibromyalgia for that matter. But we certainly have seen this. We have seen that SAMe can really be beneficial for people who get side effects from certain antidepressants. Sexual dysfunction is a very, very common side effect that goes along with SSRIs. So things like Prozac, for example. And they find that when they give them an adjuvant dose or treatment of SAMe, that this can lead to greater improvement of sexual functioning. So we know that the SAMe is required by the body. And while we may have just found out about it back in 1950, does not make it less important. It's kind of like coenzyme Q10 was found around that same time. We now, 70 years later, realize the true importance of CoQ10. I always say to people who want to be maybe slightly pessimistic or dismissive of, different nutrients or supplements. And I always say, if you can test something in the human body, then it probably has a significant role. Like if you can do your blood level of CoQ10, then it's probably pretty important. If you can take your blood level of SAMe, then it's probably pretty important. And so these are things that are naturally in the body. And if we are lacking in them, we can see how this can start to affect. It can affect cellular aging. It can affect the way that our genetic code is. It can affect the way that the synthesis of those nucleic acids is actually working and can really lead us down a very unfriendly path. So SAMe is a wonderful supplement to definitely consider for a multitude of different health concerns, from liver health to inflammatory health to looking at cardiovascular health, now understanding that it helps to boost up our endogenous antioxidants. So I definitely encourage you to check it out. If you're not sure as to how to take it, when to take it, how much you should take, definitely reach out to one of our nutritional experts and they will be happy to guide you through that process. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. And we will see you next time for another episode of the Invite Health podcast.